We all know by now the Betta Edu story. Over R500 million meant for humanitarian assistance was transferred to a private account. Now, once it was discovered, concerns were raised about it. Until now, investigations are still ongoing to find out what really happened and why exactly that money was transferred to a private account and who exactly is to blame. Now, what you may not know is that as investigations are ongoing and the minister remains suspended, the president has directed a handover to the permanent secretary, Federal Ministry of Humanitarian Affairs and Poverty Alleviation, Betta Edu, who got the letter to take over the affairs of the ministry. Now, this would have been the absolute best option, except for the fact that it also happened under his watch. So wait for the twist. Stick around long enough and you'll find out. Then there seems to be a drastic decline, if not total collapse, in Zimbabwe's healthcare system. And that has been brought to the fore again with the rising cases of cholera being recorded in the country. But Zimbabwe is just one of the many cases across the African continent. Our focus will be on these two stories for today. I'm Blessings Mosugu, and this is VSA. But first, the headlines, and of course, we have a breaking news in the studio. Joining us to do that is Dashin Usman. Hello, Dash.
Hi, Blessings. Thank you so much. All right, so the breaking news here says that Nigeria's inflation rate is now at 28.9%, according to figures from the National Bureau of Statistics, that's the NBS. This was disclosed in the NBS December 2023 Consumer Price Index, which was released on Monday afternoon. Now, the CPI measures the rate of change in the price of foods and services. And before Monday's release, the country's inflation rate was at 28.20, and that's as of November 2023. Again, this is talking about the cost of living crisis, and Nigeria's inflation rate has risen to 28.9%. Now, moving on, we begin the news again with President Bola Tinubu saying that he has performed the wreath-laying ceremony with other dignitaries to mark the 2024 Armed Forces Remembrance Day celebration in Abuja. Now, all service chiefs, led by the Chief of Defense Staff, General Christopher Musa, and heads of other security agencies, among others, also took part in the ceremony. This program, which is organized yearly to commemorate Nigerians' fallen heroes, also witnessed other activities such as prayers, gun salutes, and the release of pigeons at the National Arcade, Eagle Square, Abuja. The National Working Committee of Nigeria's opposition People's Democratic Party has sent petitions to the National Judicial Council and Federal Judicial Service Commission over its members in the Senate, House of Representatives, and Plateau State House of Assembly sacked by the Court of Appeal last year. Now, the Court of Appeal sitting in Abuja had in November last year sacked all 16 members of PDP in the Plateau State House of Assembly for pre-election matters bordering on alleged disobedience of court order and lack of political structure. Kano State Governor Abba Yusuf has returned to the state days after the Supreme Court affirmed his victory at the March 18, 2023 governorship polls. Earlier, the Court of Appeal and the Governorship Election Petitions Tribunal sacked the governor, but on Friday, the Apex Court reversed the decision of the lower courts. On Sunday, people thronged to the streets as the governor arrived in Tamburawa, Dawakin Kudu local government area of Kano State. The federal government of Nigeria has expressed worry over the frequent destruction of electricity assets nationwide, stressing that it was in the process of making a new law to tackle the menace. Speaking at the inauguration of 300 kilowatt peak power solar PV pilot project in Kainji, Niger State, the Minister of Power, Adebayo Adelabu, reiterated that the destruction of some power towers around the country had been reported to the National Security Advisor in order to strengthen security around the power infrastructure. Staying in West Africa, Guinean military authorities have arrested French journalist Thomas Dietrich amid reports of a deteriorating press freedom situation in the West African country. Now, the journalist was arrested on Sunday in the capital, Conakry, while investigating alleged corruption in the country's national oil company, Sonap. The journalist claims to be interested in how certain officials of Guinea's transitional government had acquired their wealth and had been in the country for several days to investigate Sonap. And that's it on African headlines. And it's over to you, Blessings.
Thank you so much, Dash, for the headline story. See you again soon.
See you soon.
All right, we're going straight to VSA very shortly, and we're going to be taking a look at why the Civil Society Legislative Advocacy Center, CISLAC, is worried about the transfer of power from the Minister of Humanitarian Affairs to the Permanent Secretary within the same ministry. You don't want to miss this one. Stay with us. Thanks for staying with us on VSA. Now let's get straight to the meat of the matter. CISLAC, which is the Civil Society Legislative Advocacy Center in Nigeria, have kicked against the running of the Ministry of Humanitarian Affairs by the Permanent Secretary, Abel Enitan, following the suspension of the Minister, Betta Edu, for an alleged fraud of 585.2 million naira. We're talking $500 million. Now, according to CISLAC, Enitan's appointment to take over the affairs of the ministry following the suspension of the Minister of Humanitarian Affairs and Poverty Alleviation, Dr. Betta Edu, by President Bola Tinubu is not proper because he's supposed to be on suspension and investigated as well based on the fact that the 585.2 million naira fraud allegedly happened under his nose as a permanent secretary. So why is he the one taking over? For all we know, he may have had a huge role to play in that as well. And these are the conversations that have been, spiking and going around the internet. And today we're going to put to rest this matter to find out why exactly we can trust the permanent secretary and not exactly trust the minister. Well, that said, I'll be joined on the show to talk about this by Kingsley Chime, a legal practitioner in Lagos, Nigeria. Thank you so much, Mr. Chime, for joining us.
Thank you, Blessing, for having me. It's a pleasure.
My pleasure. All right, Mr. Chime, let's talk about this controversy. There's been a lot of, disagreement as to whether or not Enitan should take over. That's the permanent secretary of the same ministry, that Betta Edu was spearheading. What are your thoughts on the suspension of the minister, first off, and the allegations of misappropriation of funds in general?
Well, thank you so much for having me once more. It's unfortunate that just a few months into the life of this government, we are beginning to see allegation of malfeasance and fraud perpetrated by, or alleged to have been perpetrated by one of the ministers who is currently on suspension. It's an unfortunate development, but of course, if you have followed the political appointments and fraudulent activities in the past, you see that every government will always have one issue relating to fraud or otherwise among its appointees. So it's not a news that one of the appointees are now being alleged to have perpetrated fraud of over $500 million naira. The only problem or the only issue is that it happened so soon. One would have expected that this is too early in the day for us to begin to see this type of thing. But as a lawyer, I believe that whatever allegation being leveled against the now suspended minister is on the realm of allegation until that is proven. I believe that EFCC is currently investigating that allegation. Until that is concluded and the matter charged to court and convicted, we begin to, call Betta Edu, by her proper name. But as far as I'm concerned, and as far as a lawyer, I'm trained not to, be, too forward, examine the situations on ground and be able to make an informed decision. That is one. Secondly, on the part of those who feels that the takeover by I would think that the allegations of whatever nature is personal and cannot be transferred, except those who are calling for the resignation of the now permanent secretary who is holding forth in acting capacity, has concrete evidence upon which they are basing this call. Other than that, other than the fact that he is also a member of the same ministry where this allegation, happened, it does not add up as far as I'm concerned, except and until one is able to establish that this permanent secretary has one way or the other either accessory before the fact or participated in the alleged commission of this offense. Now we can begin to say that it is not proper for him to take over. But if on the basis that he's also a member of that same ministry, that does not hold water as far as I'm concerned. Because if we are to go by that, argument, it means that everybody in that ministry will have to go and face, the probe one way or the other. So you must be linked to the crime one way or the other before such allegation, will be weighty enough to warrant the president, suspending the permanent secretary. Other than that, I do not see any basis for calling for his resignation or for him to also face, the probe.
Well,
but if in any way he's involved, likes to be involved, of course he should face the music.
So here's the thing. I do not think that people are necessarily calling for his resignation. I think what they're just trying to say is that if all of this, these things that Betta Edu was accused of happened under his watch, shouldn't it be right for him to also be investigated? Not necessarily be suspended or, be held captive until the investigations are completed. But they're just saying that it's just like saying you don't trust a child to handle something and then you give it to his brother or you give it to his father, living in the same house, when you're not exactly sure if they are if they have the same mindset towards that. Looking at what happened, right? If we're judging based on what exactly happened, there were some, speculations that the accountant general did approve it, and then the accountant general says she didn't, and then there are also speculations that Betta Edu is just a pawn in the bigger plot. So if that is the case, it probably means that there are other people who are controlling these things. And then if we're looking at it from that direction, then it means that everybody should be subject to investigations. Again, not arrested, but at least everybody's hands should be clean before we hand over power to them as well. I think that's what the argument is all about.
Yes, I understand that fact. The point is that EFCC doesn't necessarily need any civil society to call them, direct them on who to investigate or who not to investigate. The power of that investigation lies with the EFCC, and they will determine in their reasonable discretion how to go about that. If in the course of the investigation, they have invited the minister heading that ministry, and in the chain of events reveal that other persons in the same ministry ought to be investigated, they will invite them and they'll be properly investigated. But calling them, my worry is calling the permanent secretary because he was or he is a member of that ministry, even though no evidence has been shown, about his involvement or complicity in this fraudulent allegation. So if EFCC in their own wisdom and the course of their investigation feels that this man has a question to answer, of course they will invite him, but not necessarily based on sentiment or emotions, apparently because he's part of the ministry and being the account officer of that ministry ought to know or knows about the happenings. Of course, minister is in charge of that ministry as far as I'm concerned. He determines the direction that ministry is to take, and they take instruction under her why she was the minister. So if he has taken any action or in the course of the investigation, EFCC feels that this man is culpable or has questions or clarifications to be made, of course they will invite. But calling outrightly, the permanent secretary, who is a career civil servant, you have to understand that he's not a politician in the real sense of it. He has, climbed the climax of his career to become the permanent secretary of the ministry. So if, for whatever reason, was found to be culpable, of course, the FCC needs and must investigate it. But calling him without any evidence, except based on the fact that he's a member of that ministry, as far as I'm concerned, that does not make sense.
So do you think that it's time for us as a nation to start considering having an independent oversight committee to monitor the disbursement of funds for humanitarian aid? This is, of course, very unnecessary and shouldn't be a consideration at all. But looking at the fact that based on track record and precedents, this is not the first time that such is happening. We promise money to, people in some remote areas and they never get it. We try to render humanitarian aid and then the money is hanging somewhere. So should we now start looking at getting an independent body to oversee the disbursement of funds?
Well, it's unfortunate that this agency that are ordinarily supposed to, provide social intervention programs for indigent Nigerians, to give them hope and succor, especially in these trying times. I've now been embroiled with corruption allegation of the same money the Nigerian masses ought to benefit from. Of course, calls for us to have independent agency or whatever to spearhead or supersede the affairs of this ministry is, as far as I'm concerned, duplication of effort. What we need to do is to appoint people of credibility who will have the fear of God and be aware of their responsibilities as leaders in whatever capacity they serve, not necessarily in duplicating their efforts, because on any other ministry you are to create to oversee them, who oversees them? So it continues to, because most of these fraudulent activities, they are organized crime. One person cannot conveniently perpetuate this act. So even if you are creating another agency to oversee their affairs, particularly with transactions, how are we sure of that agency we are creating? Are we going to create them? Are they going to come and appoint them from heaven? They are still part and parcel of our society. So, and that will also, eat deeply into the economy of this country. We are talking about cutting the cost of governance, reducing this duplication of ministry here and there, who are basically doing the same thing. So it's for us to, appoint people of goodwill who have the fear of God and knows the responsibility bestowed on them, and not necessarily in creating other agencies to oversee particular agencies.
Right. Now let's talk about the executive arm, of Nigeria. We've seen several times where cases that should be investigated, not like they do not get investigated, but it drags unnecessarily. So looking at this case, for example, do you think, in your opinion, that the executive arm is capable of carrying out investigations in due time and, at least getting to the bottom of this and finding out what exactly happened so we can all move forward? Or is it going to be a case of another 2-3 years and then we're still trying to find out what happened, and at the end of the day, the issue is forgotten like it never happened?
Well, we have to understand that our criminal justice system will operate an accusatorial system of justice. No matter the noise in the public space about this allegation of fraud, and I understand the disenchantment of Nigerian people, especially when it has to do with a public office holder. There is this mistrust among people, among Nigerians, that their leaders do not mean well for them. So each time such allegation being leveled against a political office holder, there is over sensationalization of such allegation, and people will be calling for heads to roll. But the point is that we have a responsibility, to have a duty, particularly the prosecuting agency, the EFCC, to ensure that they have a concrete evidence upon which they prosecute this minister. It's not just, doesn't end in newspaper reportage or media. They must show credible evidence, prove beyond reasonable doubt that indeed this allegation of crime has been committed. So it's not really about how long it will take, it's about doing the proper thing. And if indeed, in the course of the investigation, they also found that this woman has not committed any crime.
All right. On that note, Barrister Kingsley Chime, legal practitioner in Lagos, Nigeria, thank you so much for joining us on the show. We appreciate your time with us. All right, you're still watching VSA, and we'll go on a short break. When we come back, we'll take a look at the cholera outbreak, the spike in cholera cases across the African continent, using Zimbabwe as a case study. Stay with us. Thanks for staying with us. You're still live with us on VSA. Now, Zimbabwe only has 6 central hospitals, and so far, the country has had more than 17,000 cholera cases in this latest outbreak. There's no clean drinking water in urban homes, and this has triggered many episodes of cholera and typhoid at different intervals, resulting in many Zimbabweans dying from cholera and typhoid. But of all the cholera cases across the African continent, this is just one example. In the last 20 years, more than 2.6 million cholera cases and 60,000 deaths of the disease have been recorded, and this is mostly in sub-Saharan Africa. Now, the situation in Zimbabwe serves as a stark reminder of the urgent need for action to address the spread of cholera in Africa. With only 6 general hospitals in the country, there is a clear lack of capacity to adequately treat those affected by the disease, and that's why you see people getting treated under trees. It's a sobering reality that demands immediate attention from the government and, of course, from the international community as well. And don't forget, this is not just a Zimbabwe problem. It's a problem that cuts across the African continent at large. Now, anyways, joining us to have this conversation, we have Maziko Matemba, community health professional in Malawi. Thank you so much, Maziko, for joining us.
Thank you so much for inviting me to this important topic. We're discussing about cholera in Africa.
Of course. Now, Maziko, this is, like you said, a very important topic, and this is not the first time we're talking about cholera outbreaks. We've literally been talking about outbreaks for like the past 2 months, especially on the African continent. Now, talking about cholera cases, what would you say are the main factors that are contributing to the spike in cholera cases, not just in Zimbabwe now, but across the African continent?
Yes, first of all, it's so saddening that African were still registering these primary health care conditions which I think by now would have been, done with them because they're preventable in nature. So if we are failing as African countries failing to contain some of the diseases which we can contain at primary care health care level, how are we going to attain the Universal Health Coverage 2030, but also the primary health care agenda goals by 2030? What is more concerning about African region, I think there are many, challenges are many. But key to the fact is that most of the African government hasn't invested into the health system. If you go around the world in Africa, most of our budgets, if you look at our investment in the health sector, we had the 2000 Abuja 15%. Most of the countries are not even there. If you look at even the gross domestic product of 5% at the minimum to the health budget, most of the countries are not even there. Most of the African countries rely on the global north to support their health system, and the indicator on cholera it just shows that how unprepared we are. And I've just mentioned earlier about Zimbabwe that they only have 6 major central hospitals, and if you look at even those hospitals, you find that I think they were built a long time ago. I think haven't been maintained. Maybe they have never had new ones, including here in Malawi as well, and most of the African countries. And also, when you look at the data, where I think cholera is becoming widespread, you find out that most of the countries who are affected by cholera, they are the countries who haven't invested much in their health system at primary health care level. So, if indeed our governments they keep on this route, I think we'll not be able to achieve. And I know that in African region, as well, where at the AU recently they established an arm called Africa Center for Disease Control. I think they've got a lot of work to do, making sure that some of these primary health care conditions, the things of the past. But currently, look at Zimbabwe, Zambia, Mozambique, Malawi as well. We also registered some cases. South Africa also was also affected. You can see now, I think most of the things are coming because of lack of investment.
All right, Maziko, one of the major factors that causes the spike in cholera cases is the fact that most areas, especially in some of these remote areas in across the African continent, lack access to clean drinking water, and this impacts the spread of the disease in not just rural now, but urban areas as well. If that has been the case for years, Why is it that the government is not intensifying efforts to provide, just like you said, clean drinking water to these areas, at least for a start? Is it that the priorities do not lie there, or they do not see it as important? Or is it that there are bigger challenges that is hindering, the ability to provide clean drinking water to these areas?
Yes, I want to agree with you that yes, indeed, I think ability for African government to be able to provide clean water in urban but also in rural areas is one of the contributing factor. But also, if you look issues of about community engagement. But if you heard my area contribution to this important topic, I discuss about investment because for the city or the urban to have clean water, it means you need to have a very good investment in terms of the water sources in the cities. Because if you look at most of the cities, most of those water sources, I think the infrastructure was built a long time ago and they haven't been maintained. And there haven't been much investment in making sure that people have clean drinking water in urban areas. But also, if you have seen most of the African governments, you find that issues of water and sanitation is not given highest attention. You find that we have toilets, we have even other places where people need to sanitize. I think they're well not done or maybe not well coordinated within the city, but also even in the rural areas. So if the African government will not be able to tackle this, we'll be in trouble. But also looking at the safe drinking water, as I mentioned earlier, that find that the water sources in most of them they're not well drained. We don't have good drainage system. We don't have good toilets in our cities, even in the schools. If you go to most of the schools, I think the sanitation is not looking good. So if you have cases like cholera of this nature, you find that in a few time, you find most of the places cholera is more over the place. You look at the cases of Zambia. Zambia has haven't opened school for this year until further notice because if they are fearful that if indeed the students are allowed to go to schools, they find that maybe there'll be more spread of this disease. And that is coming because of the background of that we haven't invested much in water sanitation in our schools, in our towns and cities, but also in the rural areas. I think so. This should be a wake-up call for African government to look at this very, very seriously when they'll be discussing at the AU, but also when they'll be discussing with WHO and and other agencies, but also discussing with the Minister of Finance, because for us to have all these infrastructure, all this equipment, even issues of community engagement, for someone to travel and provide those services, you need someone who's capacitated. Because as you know, our funding mechanism in African region, they're more from global north, and they are towards a few disease conditions where I mean maybe cholera and other conditions are not included. So this is a wake-up call for African governments. I'm hoping they are learning hardly, but also issues of training communities. For example, you can see that people are just maybe throwing garbages everywhere, and there is no proper sanitation in our towns. There's no proper bylaws and regulations in our cities to make sure that we have clean cities where I think when the cases of this year comes into being, I think people will not suffer. So there's been a lot of things about infrastructure, issues of access to clean water and others, and even having a strong community engaging system. Those are some of the key things which are doable. But I think the question could be, why are we still failing not to do the basics when we know that cholera is preventable?
Right. Now, let's look at Zimbabwe, for example, with only about 6 general hospitals. And we do know that if the cholera cases keep spiking, which it already is, there's definitely going to be an increase in the number of people needing treatment and the number of patients. Now, in Zimbabwe, for example, we're seeing that people are getting treated under trees, which is, I think, the most debasing situation. It has become so bad that people no longer have access to these hospitals because of the number of people needing treatment per time. Now, this is, of course, one of the major challenges, in the health sector, in healthcare facilities across Zimbabwe. But is this peculiar to other African countries? And what are other challenges that the healthcare sector faces, especially in the treatment of cholera across the continent?
Yes, I just want to agree with you. Issues of infrastructure, because if people are being treated under the tree, it shows that either there's no hospital or the hospitals are overwhelmed. It shows that our estimates in terms of how many hospitals we need to have, and also our health workers to be able to manage some of these conditions are not there. It goes back to the same issues of health investment, issues of health financing. And we have heard in 2019 that African leaders met, and President Kagame is chairing a committee on health financing in Africa, more especially on domestic resource mobilization, on how much money should go towards the health sector. But even though since 2019, most African countries, you find that their financing for health sector is very minimal. More especially looking at these primary conditions. These are basic conditions which identify how good our health system is. In fact, I want to share that, as you know, most of the health systems in the world have been defined by on how they cope with the emergencies they're having. If you look at the issues of cholera, for example, issues of polio, these are some of the basic conditions which have been there at time immemorial. But the question could be, how are they still African been suffering with these conditions? What is the major problem? We have gone ages and the people have been trained with these conditions. What could be the lasting solution to these areas? Because we don't want to be seeing people dying out of this basic condition. For example, in Africa, according to the estimate which I have, according to WHO, that only last year to this time, we have about 667,000 cases of cholera, and we have lost about 4,000 people in Africa. And these figures will keep on increasing, more especially which becomes saddening is that people are dying of the condition which is preventable and it's curable. But why are we allowing those to happen? So there's a lot of work need to be done, more especially looking at issues of investment in Africa, in our hospitals, in our health workforce, in our community, more especially now. And we all know that this is a rainy season in most of the African countries in sub-Saharan Africa. But why are we not prepared? Why are people building houses where there's no proper sanitation? How are our city dwellers, but also our communities, our planners and designers allowing this to happen? Because all these things happening because there's been a lot of mismanagement of how African countries are managing their places, how they're building their houses, and also how they're coping with issues of drainage, issues of sanitation, even of water. So there's a lot of work to be done that African countries need to wake up and be able to start doing the needful. More especially now, we have heard that vaccines are not in supply in most of African countries because currently there's short supply of cholera vaccine globally because the manufacturers are not manufacturing as much as we could because maybe there are few countries who need of this vaccine. So that should be a concern. But cholera, everybody knows, is preventable. If you do the preventable measures, cholera is doable. But it's saddening to see that our hospitals, for them maybe to be managing other conditions like maybe cancer, other maybe diseases which are very difficult to manage, but now they are now managing basic conditions, and our hospitals are overwhelmed. You look at Zimbabwe, hospitals are full, and people are being treated on a tree. This tells a story that things are not going on the right way. Investment in health sector is needed, and it's an urgent matter. I'm hoping African leaders they will be discussing this at the AU as a matter of HSA, but also a matter of saving lives of their people.
All right, Mr. Matemba, thank you so much for your opinion so far. Please still stay with us. We have joining us now Tasimba Mhizha, Project Manager and Country Leader on the CDC-funded Harare, Zimbabwe. Thank you, Tasimba, for joining us. Do we have Tasimba with us? Well, if not, Maziko, I'm still going to come back. Oh, Tasimba, is that you?
Yes, thank you. Thank you so much.
All right, thank you for joining us. We're glad we could get you before the session was over. Now, before you joined myself and Mr. Matemba, we're talking about, cholera spike, not just in Zimbabwe, which is our case study, but across the African continent. And we're trying to see how, the government can prioritize, especially, although not limited to, providing clean water to not just rural, but also urban areas. And I'm going to ask you now, Tasimba, if you were to prefer a solution to the spike in spread of cholera cases across the African continent, what would you say that the government needs to prioritize to make sure that this, viral trend is reduced to the barest minimum, if not totally eliminated?
First of all, what I think I'd like to emphasize is the fact that cholera is not a localized disease. What would happen is it starts in an area, but because of how our nation, our continent is joined, it's one, in the concept of the global village with how mobile our populations are, it's not a local problem. It's something that initially governments should come together, and we're looking at border health solutions where even at the port of entry, be it between countries, be it between counties, provinces, and districts, there's just the health checks that are going in to ensure that as our mobile population moves, we're really at the top of our game in terms of preventing the spread and the transmission of cholera. This is how we as Africans can look out for one another, so that we don't look at it as a problem that's only in Zimbabwe, or a problem that's only in South Africa, in Malawi, in Nigeria, wherever we are across the continent. But then bringing it down to a local level, it does come down to the provision of safe and clean water. And in the case where you actually cannot find or cannot provide the safe and clean water, it's encouraging safe sanitary practices. So that's really where health education comes in, teaching the community household water management, how you boil your water before you use it, you filter it in the case where you prefer not to boil it, or you're treating it with chlorine or other initiatives like bleach per se. This is just to make sure that the available water is actually safe and clean. And then education would go as far to other basic things, which are encouraging the community to wash their hands, and to wash their hands often. And it doesn't really bring it down to say, oh, only before you eat or only before you prepare food, wash your hands, but making hand washing a part of all our lives. And then I think the last one, which is not underpinned enough, counts to things like sanitary practices, like using toilets. So instead of using the bush system, having our communities build even the simple pit latrines, which you'd only need for the most basic one, a single bag of cement, and where more resources are permitting to build more modern and more complicated toilet structures, and encourage the communities to stop practicing open defecation, but to actually get into the toilets and use them. And then the last one would really be around the waste disposal. So be it household waste and even all the domestic waste that you'd run into, to just encourage safe practices. Because if I practice safe disposal, I'm looking out for my neighbor as well. And at a national level, we're then looking out for each other as a continent. Thank you. Over.
All right. Thank you, Tasimba. Very spot on. And I believe that most people or communities or even countries do know that these are the things that they need to do. But I think that the challenge we have is creating awareness. Not many people, especially in those remote areas, understand how serious these issues are, understand how seriously they need to take, this measures that you have just mentioned and implemented to prevent the spread of cholera outbreaks. And we do hope that the awareness is intensified. But very quickly, I'm going to come to Mr. Matemba before we wrap up. Talking about the use of technology now, how best would you say that technology can be utilized to both monitor and, of course, track the spread of cholera in affected areas so as to mitigate the effect and reduce the spread?
Yes, I just want to agree with you that I think use of technology is key. And my colleague from Zimbabwe, as he mentioned clearly on the issues which we need to do, use of technology is key. Because for us to have real-time data so that our health workforce can respond quickly, I think is critical now. Most of the African government are encouraged to have digital health in their system, training our community health workforce to be able to transmit that data at the time as it needed, so that our system can be able to track and be able to follow up some of these cases. Time has come now for African government now to do innovation, but also using of media, as we are talking now. Media also very powerful tool in making sure that it disseminates some of these messages to our communities. What is happening most is that most of those messages have been there for some time. But I think with change of time, I think we need to go back to the drawing board and be able to reinvest into in messaging transmission to our community members. For example, how they can make sure that they are preserving food, but also water, so that it's not contaminated by all these things. In Malawi, we tried under community health, where we invested in engaging community leaders, chiefs, civil society, youth, and other groups at an interval every quarter, so that they should be able to know some of the basics about primary health care. Last year when you had COVID, I'm hoping those are some of the initiatives which you need to do, but also use it for data and innovation. Make sure that we're able to transmit some of this information, and also having real-time response team. Most of the use of surveillance. We need to have a very strong surveillance team. But also, what strikes most is what my colleague has just mentioned: issues of intercountry and issues of migration. For example, in Malawi, one of the cases which we received on cholera a week ago was coming from Zambia. He's a truck driver, and when he came to Malawi to deliver some goods, he was found with active of cholera. So we cannot run away from intercountry. So we need to make sure that cross-border initiatives there also be there are a lot of screening happening, investing in surveillance, but also making sure that we also have commodities in place, make sure that some of these things are done. But most key is to make sure that prevention is key. Cholera is preventable, and the same way of doing it, make sure that the water is being preserved,
Okay.
and we have chlorine in place, and making sure that people are not maybe using toilets in the bushes and all those things. I think we need to go back to the drawing board. Fortunately, in Africa, we have structures in our communities which you can utilize, but we are not utilizing them much.
Okay.
That's why our ministries of health and our local leaders need to make sure that they take this responsibility, because we don't want people to be dying out of this primary health care condition.
Okay, thank you so much, Maziko Matemba. We've come to the end of the conversation, and it's been very insightful and, of course, enlightening, talking about the spread of cholera, not just in Zimbabwe now, but across the African continent. And, of course, so much solution has been shared, and we do hope that the government will hop on this and make the situation better by mitigating the effect of cholera and, of course, reducing the spread altogether. Thanks to my guests for making it so insightful. Tasimba Mhizha, a project manager and country leader on the CDC-funded Harare, Zimbabwe. And, of course, Maziko Matemba, community health professional, Malawi. Thank you, gentlemen, for contributing your own quarter to this conversation. And we do hope that it gets better from here.
Thank you so much. Thank you. Bye-bye.
All right, and that's all we can take on VSA. Thank you so much for joining in on the conversation. We have talked about the political leadership in Nigeria. Speaking of the Ministry of Humanitarian Affairs and what can be done to make sure that everyone is held accountable for whatever part they play. When it comes to disbursing funds. And of course, we talked about cholera outbreaks, not just in Zimbabwe now, but across the African continent. Zimbabwe, though, has it worse because now we see people being treated under trees, and we're hoping that the government will weigh in on the situation and try to mitigate the effect so we can have at least less people needing treatment at the end of the day. And thanks to all my guests for making it a very interesting conversation altogether. Do well to joining on the conversation by following us on all our socials, and of course join us in our subsequent episodes as we discuss issues as they pertain to the African continent. It's been VSA, and I am Blessings Mosugu.